So now we'll have Dr. Ganesh to talk on we have covered cornea, retina, glaucoma now. So what is new in the management of glaucoma?
Thank you, sir. At the outset, I'd like to thank the chairman of the AIOS as well as KSOS for providing me this opportunity. I'll be speaking to you on what's new in glaucoma therapy. So, as you know, you have a lot of glaucoma medications. You have aqueous suppressants, medications reduce EVP, increase trabecular outflow, and increase uvascular outflow. But what's come new in India, and it's I think we should be proud about, is because it's manufactured by Indian company, is the triple fixed dose combination. So the rationale is you have three medications which have all three components, and the main advantage, as you will see, is that the compliance and the BAK and all reduces. So this is the first clinical trial on fixed triple dose combination known as TriSopt by the, I don't have any financial disclosure, as I mentioned before, it's by the Microvision company. And it was a nice open label multicentric, and we all participated in it in a phase 3 trial. And you can see from the pressure of 25 millimeters of mercury, the intraocular pressure at 12 weeks became 15 millimeters of mercury, and a lot of people using this medication, including patients, are very, very happy with it. So you can see almost a 10 millimeter drop. So these patients at 25 millimeters of mercury were already on combination of timolol, brimonidine, or timolol dorzolamide, and then the triple medication was added. So the side effects are also very, very extremely less. So it has a complementary mechanism of action, better compliance, reduced preservative exposure, and efficacy, safety, and tolerability is quite superior. So this has now become the almost go-to drug, because all the three molecules can be used in all forms of glaucoma, not just, just open angle or angle closure. Even in inflammatory glaucomas, you could use this. Now coming to other set of groups of medications. In India, we always have multi-dose vials, whereas abroad you get all these unims. And so now the drug delivery systems have also improved. I'll just show you two of them. So this is the Aptar ophthalmic squeezer, which is commonly used by the Cipla company. So the drop is actually a defined size, and it has a dual channel system to release the drop from the tip. Sorry. And there's a sealing membrane which opens up to allow the liquid in the dual channel to pass from the tip, and then the air intake is permitted through a 0.2 micron sterilizing filter. And the drop comes out, and this is the mechanism. So the drop comes out and is compensated by the air, but which goes through a filter, sterilizing membrane filter. So this is something very, very important. Secondly, again, we have the Novelia bottles, which are commonly used by other companies, and the nozzle selection is about 28 to 46 microliter, and drop size, viscosity are standardized. And upon exit of the drop from the bottle, the exit valve closes and air intake occurs. So why we are talking about this is when you do a phase 0 trial on animal studies, you use preservative-free medications. But when it comes to humans, you add preservative and give the medication. So that's quite a paradoxical thing. And those patients have to use it for almost 30, 40 years of their life. So these are something which we should incorporate. And preservatives like BAK, what exactly they are? BAK is 0.02%. Your Harpic contains 10% of BAK. So what you are actually putting in is your Harpic into your eye, And then coming to the technology and the glaucoma screening, if you see, we have a good way of taking, screening for glaucoma, and in our clinics we have this opportunity screening. So for both for open angle as well as angle closure, there's a series of publications, and now we are in the last trial where we are screening almost 30,000 patients, and asking their relatives come for follow-ups and get screened for glaucoma. And if you see the incidence, so if you have a patients with open angles, and their siblings will almost less than 10% may have their siblings will have angle closure or angle closure suspect. Whereas if you take the PACS program, you'll have a significant number of their siblings with PACS. And if you see a PSC proband whose patient sitting in front of you, he's got PSC or PSCG, you'll find that significant number of their siblings are likely to have angle closure. So that's something which you have to think of. You see angle closure glaucoma patient, make sure that they are screened, the family members or their siblings are screened. Similarly, if you have a patient with uh, angle closure disease, their siblings are likely to have twice the number of chance of having angle closure glaucoma compared to a patient with PACS. So that's quite significant. So laser devices are again something which have come in now, and we are using this quite commonly. So you previously had the flash pumped diode laser, so it would function as a photo disruptor. Now you have the diode pumped neodymium orthovanadate dual function lasers, and I won't go into the results of it. I think you could, as the results come out, you can read it in the publication. But the advantage of this is you can cross subsidize these lasers. So you have on the left side you have SLT with photo disruption, and these are the companies which manufacture and sell it in India. On the right side you have photocoagulator, and these are the ways you could use this laser to cross subsidize your SLT. So it's a win-win situation for both all type of ophthalmic patients. Minimally invasive glaucoma surgery are numerous, and you have huge advantages, and now it's a go-to procedure for glaucoma for mild to open angle glaucoma. Nice review by Dr. Vanita Pathak about minimally invasive glaucoma surgeries. And these are the types of devices which we have. And they are more physiologic. So you have the KDB device, and then you have the iStent devices, and then you have the Tanitos microhook, and then you also have the GAT procedure. So all these devices are quite useful. They address the main problem in glaucoma surgery, which is the trabecular meshwork, and more physiological, and you have options of doing repeat surgery or the conventional glaucoma procedures later on in the patient's life. So the idea is to reset the AGM clock of the patient. The patient, if he has to use glaucoma drops for, let's say, about 20 years, 30 years, if you do any of this, you're taking away 7 to 10 years of their life on medication. So I'll just talk about this lady. She presented to us in 2022, and she had phthisis bulbi in the right eye, and she was on 5 drops, juvenile open angle glaucoma patient on 5 drops, pressures of 42, and vision of hand motion. She was referred to me to do a diode laser for the seeing eye with a vision, because everybody gave her a very poor prognosis. So I did a canaloplasty for her, which is of course not a minimally invasive glaucoma procedure, but is very useful for her. And slowly, if you see over a period of about 1 year, the intraocular pressure remained flat, and the visual acuity improved from HM to 5/60 and 6/60 thereon. In this situation, she traveled from Raipur to Gujarat, from Gujarat to Delhi, and then she took almost 5,000 kilometers to reach us. So although we have a lot of technology and a lot of scientific content behind our, we still need to, as glaucoma surgeons and ophthalmologists, put ourselves in the patient's shoes and see how we can improve their lives. Thank you very much.
Wonderful presentation, Ganesh. A lot of learning, in fact, about this. Last slide was quite emotional also, and but very good that from hand motion to 660, you made this lot of change in her life. In fact, yeah. Otherwise, you see such people may develop suicidal tendencies. In case you have PLPR or hand motion vision for a long time, young girl. Excellent job. So, after a lot of wonderful talks, I think must congratulate Namrata on this.